New data has revealed the wider impact of COVID-19, showing NHS waiting times reaching an all-time high in England. 5.98 million people were waiting for staff hospital treatment at the end of October this year, and more than 2 million people waited for more than 18 weeks to be seen.
Dr. Marlyn Farnsworth is a frailty specialist.
Morning, Valerie. I'm Marlyn. We met previously.
And her expertise is in constant demand. Valerie is 83 and lives alone. She fell out of bed, but luckily could still call for help.
I took a bad fall, so I've got my problems are a walking problem.
Valerie's support will extend beyond her hospital bed. Dr. Farnsworth calls it wraparound care, dedicated support from a team of specialists.
Most people want to be in their own homes, and most people want to have the treatment and the care in their own homes. And if we think that's safe and we think that's appropriate and in line what matters most to Valerie, then that is what we will support. And we have a team of doctors, nurses, therapists and social care colleagues that can deliver that treatment.
Discharging people is a huge problem for the NHS. 1 in 10 patients can't be sent home, even though they are medically fit. Luckily, Valerie isn't one of them.
I mostly look after myself, though, but I've also got some very, very good neighbours who will do shopping for me and what have you. So, in one sense, I'm spoilt in that way.
A few beds down from Valerie is Asha Khan. She has stage 4 cancer, but the first hospital she was taken to couldn't find a bed for her and asked Epsom for help. This is the pressure on our health service. And it's right across the NHS. There were more 999 calls last month than any November on record.
I need to be in A&E, please. I took a fall.
That pressure will continue into December, and with a threatened surge in Omicron cases, is why the government felt it had to intervene.
This time we're trying to progress with our elective work, and we still have our winter pressures coming in, which I don't think we can turn away like we did over the previous 2 surges. So I'm actually more concerned this time if we do absolutely nothing.
All hospitals are trying to clear their waiting lists, but this winter is likely to be the hardest yet. The hospital is rightly very proud of the integrated care it can offer its patients like Valerie. But if there's a surge in COVID admissions, well, that puts pressure on one part of the hospital, and that pressure soon spreads through the system. Valerie is going for her last scan before going home. More patients here will benefit from this support network, just as long as the COVID storm is kept at bay.